From Microbe TV, this is Beyond the Noise, episode number 48, recorded on January 6, 2025. I'm Vincent Racaniello, and joining me today is your host, Dr. Paul Offit.
Hi, Vincent. Happy New Year.
You too. Good to see you. We haven't recorded since September, but things are getting worrisome, I would say, and so it's time to record again. This is the video version of Paul's column on Substack called Beyond the Noise, Cutting to the Chase on Important Health Topics. Today I'd like to take a closer look at Paul's two columns, Questions for RFK Jr.'s Senate Confirmation, Parts 1 and 2. Now, we've previously recorded multiple episodes about RFK Jr.'s anti-vaccine stance. In each one, we worry that he might be given an important health appointment, and here it's happened. So he needs to be confirmed by the Senate. Is that correct?
Right.
And so a committee will ask him questions, right? Will it be a bipartisan committee?
Yes, it's a bipartisan committee. All
right. So you have put together some questions that if you were on the committee, you would ask, right? And so
right.
let's go through some of those. The first one is RFK Jr.'s statement, no vaccine is safe and effective. What would you ask him about that?
Right. So he was on a podcast by Lex Friedman, which is a very popular podcast, has 3 million viewers. He was asked the question, do you think any vaccine currently used is safe and effective, is beneficial? And he said no, that he didn't think any vaccine was beneficial.
There's no vaccine that is, safe and effective.
So I would like to ask him the question, do you still think that's true? If you think that's true, then should we just abandon the CDC's immunization schedule? Should we just stop giving vaccines? If you think they're not safe, if you think they're not effective, should we just stop giving them? Let him answer that question, because I think he's clearly a virulent anti-vaccine activist. He's not kidding. This is not something he's paid to do. He's a believer. He's a zealot. He thinks that we have simply traded in infectious diseases for chronic diseases, and he sees himself as a savior of children. And so I'd like to know just how far he's willing to go.
Yet he himself has received vaccines, correct?
Yes. Not only that, a couple of years ago, he had a party during COVID at his home, and he and his wife insisted that no one could come to the party until they were vaccinated and showed proof of vaccination. So it's at least hypocritical.
I would wager that there are some people in the U.S., maybe 48 million or so, who would like to be vaccinated and who would like their children to be vaccinated. So why should his opinion prevail?
No, I think that is a really good point. I mean, we talk about how, doctors are standing up here, nurses are standing up here, public health officials are standing up here. But I think the strongest, most powerful group are parents who see vaccines as something that have saved their children's lives, who see it as the best way, the safest way to protect their children. And that is a large army to go up against this kind of thinking.
It's just incredulous to me that someone who has said that and all the other things that he has said, as you'll hear, is nominated for the head of HHS. This is just crazy, right?
It's like a Saturday Night Live skit. You have,
Yes.
Don't you want from someone who's going to head the largest public health agency in the United States? At the very least, this would be at the top of the checklist. I mean, the fact that he has said or has felt compelled to say, quote, I will not ban vaccines. I mean, why would anybody ever have to say that who was about to be Secretary of HHS? Of course they would support vaccines because vaccines have saved our lives. We live 30 years longer than we did 100 years ago, in large part because of vaccines.
All right. Speaking of vaccines, the next one is his statement that polio vaccine has killed many, 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 many more people than polio virus ever did. I don't know if I got enough manys in there. So what is that all about?
So that was actually a follow-up question by Lex Friedman. I think Friedman was surprised when RFK Jr. said that he thought no vaccine was a benefit. And so he had a follow-up question, which was, well, how about the polio vaccine? Because this is something, at least among those of us who are older, experienced in our lifetime. I mean, the polio vaccine was first introduced in 1955. But at that point, you had tens of thousands of children every year who would be permanently paralyzed. You had thousands of children every year who would be killed by this virus. And in many of our lifetimes, we saw this virus go away. It was eliminated from the United States, at least wild-type virus was eliminated from the United States by 1979. And so he was incredulous. And so he asked that follow-up question, and that was the answer, that this polio vaccine, as he said, sort of during my generation, meaning in those who got the vaccine in the 1950s, suffered a vaccine that contained a contaminating virus called simian virus 40 or SV40. And that was true. But he vastly overstates a couple things. One is that RFK Jr. said we've seen an explosion in soft tissue cancers, so-called sarcomas, as a consequence of this vaccine.
And now you've had this explosion of soft tissue cancers in our generation that kill many, 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 many more people than polio ever did.
First of all, there hasn't been an explosion of soft tissue cancer, so that's wrong. Secondly, he's correct in that this vaccine was contaminated with a virus called SV40 because the vaccine was grown in monkey kidney cells. These monkeys were imported from places like the Philippines or Singapore to a holding facility in South Carolina, and so they were primary cells. The animals would be sacrificed; their kidneys would be used to grow both Albert Sabin's vaccine, which was a live attenuated viral vaccine, as well as Jonas Salk's vaccine, which was a whole killed viral vaccine. And then when people saw that that contamination had occurred in the late 50s and early 60s, this became really SV40, probably the most studied mammalian virus in the early 1960s, because it was found that this virus, this polyoma virus, could actually cause cancer in experimental animals. So the question is, did it cause cancer in people? Now, Salk's vaccine was inactivated with formaldehyde, which also inactivated SV40. But Sabin's vaccine wasn't inactivated. And in fact, people that were given that vaccine were given also SV40. Now, there were a lot of reassuring things. One is that that those who did take the oral vaccine didn't seem to develop an antibody response to SV40. So it seemed to just sort of pass through the intestines unnoticed. Secondly, there were epidemiological studies done 5 years later, 8 years later, 15 years later, 30 years later to answer the question, because this was an answerable question. Were you at greater risk of cancer if you'd gotten this vaccine or if you hadn't? And both in the United States and the United Kingdom and Germany and Switzerland and other places that had used those vaccines, there was no difference in cancer incidence. So it was a concern that ended up being unfounded. But apparently RFK Jr. is willing to completely ignore all those data and continue to make up this now disproven concern.
And we should point out that SV40 has not been present in polio vaccines since the 60s, right?
That's right, since those early lots in the 1960s. So for the last 60 years, that has not been true. So to continue to scare people as if this is still a problem with the polio vaccine is completely irresponsible.
It may be useful also to ask him, please tell us the reference for a peer-reviewed scientific publication that supports your contention. And you shouldn't be able to come up with it because there is none, right?
Right. He just makes it up.
All right. Next, he said the COVID vaccine was the deadliest ever made. Yet he got it, right?
Right. Presumably he got it. That's right. As did many anti-vaccine activists, by the way.
Why does he think it's the deadliest ever made?
Don't know. I mean, it's certainly, here's what you can say about the current surveillance systems. We realize that when you give vaccines, you're giving them to healthy people, including healthy young children. So you want to make sure that you have surveillance systems in place that pick up even the rarest of adverse events. Because, for example, in December 2020, when we of the FDA Vaccine Advisory Committee sat down to review Pfizer's vaccine, review Moderna's vaccine, we were basically looking at 35,000 adults who had gotten an mRNA COVID vaccine. But we were recommending authorization for hundreds of millions of adults and children. And so you know that there is going to be the other shoe that drops. You know that there is going to be a very rare adverse event that is going to follow, because that's always true. So do you have systems in place to pick it up? Yes, because we care about safety. And so what did you find? You found that myocarditis was a rare consequence of the mRNA vaccines to the tune of about 1 in 50,000 recipients. And you found that Johnson & Johnson's vaccine, the adenovirus vectored vaccine, was a rare cause of clotting in roughly 1 in 250,000 people, which basically drove that vaccine off the market, even though that was a very rare consequence and the vaccine did work, because you had a safer vaccine, the mRNA vaccines. Basically 2 years after the introduction of the Johnson & Johnson vaccine in February 2021, by early 2023, that vaccine was off the market. So those involved in public health care desperately about vaccine safety because we're giving them these vaccines to healthy children. But he sort of comes off as he's the only one who cares. He's the only one who's willing to look behind the curtain and find out what's going on. And it's maddening.
He basically makes it up, right?
Right.
No, I think for COVID, it's one of the most studied vaccines ever, right? It's quite clear that it is not the deadliest ever made.
No, I would argue the deadliest vaccine, I'd be curious to hear your thoughts on this, was probably Qattar's polio vaccine. I mean, Qatar Laboratories failed to inactivate a polio vaccine in 1955. It was given to about 120,000 children in the West and Southwest, caused about 40,000 cases of abortive or short-lived paralysis, about 164 cases of permanent paralysis, and 10 deaths. I think that was probably the worst biological disaster in our country's history.
Yeah,
That's not this vaccine.
When you have infectious virus in an inactivated virus vaccine, that's what happens. I was trying to think. Yeah, I think that would be it. There were some experimental polio vaccines in the 30s, but they simply didn't protect people in a time when there was a lot of polio virus circulating. So they, in themselves, they weren't deadly.
No, you're right. I think one was like John Comer and Maurice Brody in the 20s and 30s used either ricin to inactivate polio, which was not effective, or didn't adequately separate the virus from the cell debris, because I think Maurice Brody used formaldehyde. But so those vaccines also contained live polio virus, but not nearly to the extent of Qattar's vaccine.
I think in the modern era that it's, as you know, that we go through great extents to make sure vaccines are safe. So the Qatar vaccine would stand out. Yeah, I agree. Okay, next, he encourages people not to vaccinate their babies. Whenever he runs into people, he tells them, don't vaccinate your baby.
I see somebody on a hiking trail carrying a little baby, and I say to them, better not get them vaccinated. And he heard that from me. If he hears it from 10 other people, maybe he won't do it. Maybe he will save that child.
Right. So when he says, I am not anti-vaccine, all you have to do is look at that statement to tell you that's exactly what he is. When he says, I run into somebody when I'm hiking and they're carrying their baby, I go up to them and say, don't vaccinate this baby. And in that way, I think I'm saving their child. I think he has to answer to that in front of a congressional committee. Does he want to continue the vaccine program in this country when he's telling parents that he runs into on a running path not to vaccinate their children? Will he also tell the general public that when he's in the position of Secretary of Health and Human Services?
Well, you may be covering this in a future column, but he encouraged American Samoans not to get vaccinated, and there was a devastating outcome of that, right?
Right. There was, in that small island nation of 200,000 people, there were 5,600 cases of measles and 83 deaths, almost all in children less than 4 years of age. And he had a lot to do with that. He really kept encouraging people not to vaccinate. He always says, I don't tell people not to vaccinate. He just says that vaccines cause harms that they don't cause, which is arguably the same thing. It's like saying to somebody, if you cross the street, you may be hit by a car, but I'm not telling you not to cross the street.
All right. He continues to question whether vaccines cause autism.
Well, I do believe that autism does come from vaccines.
Right. It's this, we've been living with this now since 1998. So it's been, we're coming up to 30 years of this concern that was raised initially by a now discredited UK doctor named Andrew Wakefield, who published a paper in The Lancet claiming that the measles, mumps, rubella, or MMR combination vaccine caused autism. That it wasn't a study. It was a publication of 12 children, 8 of whom had recently received within a month the MMR vaccine and then developed symptoms and signs of autism. That ended up being retracted for a lot of reasons. One is they misrepresented clinical characteristics. Some of those children actually developed symptoms of autism before they ever got the vaccine. He misrepresented biological data, and so ultimately it was retracted. But it's fair to raise the question. It is. I mean, from the parent's standpoint, my child was fine. They got a vaccine. Now they're not fine. Could the vaccine have done it? That's a scientific question, and it can be answered in a scientific venue and has been. There's been more than a dozen studies at this point looking retrospectively at children who did or didn't get that vaccine, trying to control for the variables you need to control for, like healthcare seeking behavior or medical background or socioeconomic background. And when they did those studies, and it's been done now in 7 different countries on 3 different continents involving thousands and thousands of children, probably costing millions and millions of dollars, that question has now been put to rest, which is that you're not at any greater risk. And so I feel badly for all those people who have spent so much time and money trying to answer this question, that there is still going to be a segment of the population that doesn't believe it. Because frankly, when you raise that concern, it's hard to unring the bell. It's hard to unscare people once you've scared them. Now, I think it was worth doing those studies in the sense that at the time those studies were done, so say late 1990s, early 2000s, about 85 to 90% of parents of children with autism believe vaccines cause it. Now it's closer to 10 to 15%. So that has helped, I think, for physicians and clinicians to explain that this isn't the case. But there's always going to be that residual group, and this is the group to whom he appeals. And I think probably the most upsetting part of all that is there was a paper in the Journal of the American Medical Association that was recently published that showed that children with autism are under-vaccinated as compared to children who don't have autism. And in addition, their younger siblings who don't have autism are also less likely to be vaccinated. So the continued beating of that drum that vaccines might cause autism is yet another contributor for why children are under-vaccinated. And he has a lot to do with that. He's always had a voice in the sense that he has a famous name. And now, as even just being considered to be head of Health and Human Services, gives him an even bigger voice. I mean, I can tell you, I get calls from the media a lot trying to answer these questions, and it's never been more so than when he was nominated for this position.
So he needs to be asked by one of the committee members, why do you ignore the data, which clearly show that vaccines do not cause autism?
He believes there's 2 ways to interpret those data. The reason that researchers haven't found that vaccines cause autism is vaccines don't cause autism. That would be the reasonable interpretation. His interpretation is there is a vast international conspiracy involving thousands of academicians and researchers that is fueled by the big pharma that now has sort of in their pocket, the medical establishment and governments. And that's the reason, and that the Lancet or the New England Journal of Medicine is also in the pocket of big pharma, and that he's going to get behind that. He's going to disclose the real truth by pulling back the curtain. That's how he sees himself.
That's always what people say when they can't counter the scientific evidence, right? There's a conspiracy, or someone's lying, or any number of nonsense things that are really hard to address, right?
Right.
All right. He also states that vaccinating children with COVID vaccines is unethical.
Right. I'd like to know where that one comes from. Having worked at a children's hospital during this pandemic, we had about 3 floors of children with COVID, and we certainly had COVID deaths. There were roughly about 1,800 deaths from COVID during this pandemic. And in addition, the vaccine is clearly safe in young children. It's been tested now in tens of thousands and hundreds of thousands of young children. So we have those data now. We didn't have the data as much initially, but we do now. And in addition, interestingly, in our emergency department and many emergency departments across this country, there are a lot of children who come into the emergency department with COVID because of with bronchiolitis or croup. It accounts for about 6% of emergency department visits are with young children who had COVID, who are an under-vaccinated group. I mean, children less than 4, only about 5% are vaccinated. 95% are unvaccinated. And, when you're born, you still have passively transferred antibodies from your mother who has been either vaccinated or naturally infected or both. But by 6 months of age, that's worn off and you are fully susceptible. So the 3+ million children who are born in this country every year, by 6 months of age, are fully susceptible to this virus. And this virus isn't going anywhere. This virus is going to be circulating with us for decades, if not longer. And we can't ignore it.
Also, with respect to these COVID vaccine points, there are now some data that indicate that vaccination will prevent long COVID. Not 100%, but there is some effect. So that's a chronic disease, right? Isn't that what he would like to prevent?
Right. Sure. I mean, he talks about how we have too many chronic diseases, although he's never very specific about it. I mean, he talks about obesity or type 2 diabetes. Agreed. We have a very high incidence of obesity and type 2 diabetes, and we don't get much for our healthcare dollar. We don't. We spend probably more than any other developed world country, yet we're way down on the list in terms of longevity, in terms of infant mortality. So, right, I think it is a problem, but he doesn't really offer a solution. He just does this kind of vague hand waving of there's too many chronic diseases and we need to do something about it. But he doesn't really tell you what that is.
Well, doesn't he want to discontinue research on infectious diseases and shift to chronic diseases? Is that the solution?
Right. That's what he says about NIH. He says he just wants to fire the 600 people at NIH who've been working on infectious diseases and move them to chronic diseases, which to me misses what NIH did for us. I mean, look what NIH did for us. You had in-house people like Barney Graham and Kizzy Korbik who had been working on mRNA vaccines for SARS-1 for a long time. And then you have research-funded people like Drew Weissman or Katie Carrigo since 1997 on mRNA and ultimately mRNA vaccines. Thank goodness for NIH. NIH is the reason we were able to make a vaccine so quickly and save our lives, save 3 million American lives.
This next one really gets me. He has stated that both ivermectin and hydroxychloroquine work to treat COVID.
Right. So it was frustrating in 2020 when this virus rolled into this country, sort of late 2019, early 2020. We didn't have anything. We didn't have antivirals till October. We didn't have monoclonals till November. We didn't have vaccines till December of 2020. So people were rooting around looking for something that was in the formulary that could still work. And they settled upon hydroxychloroquine. And the federal government bought 29 million doses of hydroxychloroquine and said, even Alex Azar, then head of HHS, says you can use this. Even after data showed that it didn't work. And there were excellent prospective placebo-controlled studies given people who were early in their COVID illness to answer the question, did this prevent hospitalizations? And the answer was resoundingly no. So it didn't work. And so I would like to think in a better world when someone raises the question, an answerable question, and it's answered, that people say, thank you, this makes sense, we're not going to use these drugs, which have side effects. I mean, hydroxychloroquine can cause arrhythmias and other heart-related issues. So don't use it unless it's helpful. And if it can't help, it can only do one of two things, nothing or hurt. Those are the only other two options.
Also, ivermectin has been trialed many times and does not prevent hospitalization or severe disease. It's quite clear. Right.
No, it's just sort of treating things like horse parasites. There was one meme that I thought was at least funny, which was ask your large animal veterinarian whether ivermectin is right for you.
But of course, he will say Big Pharma is in a conspiracy because the other drugs are more expensive, et cetera, et cetera, et cetera. All right, one more. He has said that the hepatitis B vaccine does not reduce hepatitis. What's that about?
Right. He says it doesn't work. I mean, as a pediatrician, I got to watch in my medical lifetime exactly how well the hepatitis B vaccine worked. I mean, the original hepatitis B vaccine, which was a so-called plasma-derived vaccine, was introduced in 1981. And it was used sporadically. It was sort of targeted for high-risk groups, like men who had sex with men, people who were intravenous drug users. And it wasn't used a lot. So there really wasn't much of an impact on hepatitis B. But by 1991, the Centers for Disease Control and Prevention recommended this vaccine for newborns. Why? Because at that time, about 18,000 children less than 2 years of age would get hepatitis B. About half would get it from their mothers when they passed through a birth canal that had hepatitis B virus in it. But the other half didn't get it from their mothers. They got it from relatively casual contact from somebody who had hepatitis B and generally didn't know it. I mean, hepatitis B is a silent epidemic, if you will. And if you get hepatitis B early in life, you are much more likely to go on to develop chronic liver disease, cirrhosis, or liver cancer. And so in 1991, about 30 years ago, this vaccine was introduced for newborns, and it has eliminated hepatitis B infections in children. It's an amazing public health achievement. And there he is just blithely stating hepatitis B vaccine didn't work. It's really hard to watch this.
Well, once again, hopefully the committee will be knowledgeable about all of these questions that you have proposed here and ask for the data. In the case of Hep B, the data are there. And they should say to him, the data say that it works very well. So why are you saying this? But, half the committee will not ask any hard questions, as you know.
No, it seems like they hopefully they'll take what is their role, which is an advise and consent role, seriously and ask the tough questions. This is a big job. It's a $1.85 trillion program. There's 80,000 employees. This matters. You can't have somebody who's basically a conspiracy theorist, science denialist and anti-vaccine activist heading that program.
I do hope that sane heads prevail, both in the committee and then subsequently in the votes, right?
Hope
just
so.
Don't know. But the thing is, Paul, if he's not confirmed, an equally bad person will probably be nominated.
I think it's hard to find an equally bad person.
Yeah,
I agree
maybe
with
you're
you.
right.
I think there will be somebody else who's selected more for their loyalty than their expertise. But I do think it's hard to find someone who would be equally bad.
You can find Paul Offit at Beyond the Noise on Substack. We'll put a link in the show notes. That's Beyond the Noise with Dr. Paul Offit. Thank you, Paul.
Thank you.